Hello and welcome to my talk on a family pedigree for a family with some occurrence of inherited hemophilia A. Here we have our family pedigree. There are 5 generations, and as we can see, there's a variety of presentations of hemophilia A. Hemophilia A primarily affects men, but there can be mild symptoms for heterozygous female characters, which are depicted in the lighter blue color than we used for the darker blue, which is symptomatic cases. Phenotypes within our pedigree. The first phenotype is having hemophilia A symptoms, and that is going to be depicted in a dark blue filled in square for a man and a circle for a woman. And we can see here that our 3rd generation has 1 symptomatic male. He is denoted by the Roman numeral 3 and then 1. And our 5th generation has 2 symptomatic males, which are going to be the 5th generation denoted by the letter V, and they are going to be number 1 and number 3. Our next phenotype is having no symptoms of hemophilia, and that is going to be white squares for men and white circles for women. We have many examples of this. Our 1st generation married couple, one of the daughters in the 2nd generation, as well as both partners in the 2nd generation. One of the sons in the 3rd generation and his wife, both of their children in the 4th generation, and one of the sons from the 5th generation. We also have a unique minor symptom phenotype because this is an X-linked disorder. And we have 2 examples of this with the daughter in generation 2 and the wife who married into the 4th generation. So let's look at examples of phenotypes and determine what those genotypes would be. Over here we have all of our genotypes on the left, and we're going to be using a capital H for our dominant gene, a lowercase h for our recessive gene, and the recessive gene is the one that's going to indicate hemophilia. And we're going to note XX or XY because this is an X-linked disease. So our first example is in the 5th generation. We have 2 sons with hemophilia. Those are going to be V1 and V3. Their genotype would be XY and then a small h. They also have a brother without hemophilia. He's denoted by V2, whose genotype would be XY and then a capital H. Their mother, who is in the 4th generation, so IV1, is an example of a heterozygous genotype. So she's going to be XX, big H, little h. She is a carrier of the disease, so she's not going to have the hallmark symptoms, but she can, and we're saying does, suffer from minor bleeding and joint issues. Hemophilia A is a recessive sex chromosome-linked disease. It's specifically an X-linked disorder. And this means that the allele causing hemophilia A is located on the X chromosome, and it is located particularly at the F8 gene. Hemophilia A is caused by a lack of or dysfunction of the clotting factor VIII. It has a wide range of severity of symptoms. So what does hemophilia A do? It prevents blood from clotting, which can cause bleeding unexpectedly, excessive bleeding after getting hurt, having surgery, and difficulty in being able to stop bleeding. It also can progressively damage joints, cause permanent disabilities, and it can even be fatal if not treated. Mostly men are affected by hemophilia A because of it being an X-linked disease, and about 1 in every 5,000 baby boys born has hemophilia, with hemophilia A being the main type of these cases. Women that have hemophilia A tend to have less severe symptoms than men because they're heterozygous, and their additional X chromosome kind of lessens any effects that they might have. They can still have minor bleeding and joint issues. If a woman inherits both recessive alleles from her parents on the X chromosome, or she has an X chromosome that doesn't function properly, she will show those same severe bleeding symptoms that are seen mostly in men. In modern times, most hemophilia A cases are managed through treatment, but between 15 to 20% of cases can develop something called an inhibitor, which is an antibody that stops the clotting factors that are used to manage hemophilia A, and it stops that antibody from working. This can greatly decrease these patients' quality of life, cause more issues with their joints, and of course, more complications from bleeding. Early signs that lead to testing are bleeding that continues for a long time or unexplained bruises. Hemophilia A is tested for by using screening tests, and those can be followed up by clotting factor tests to see if someone's blood is clotting the way that it should be. And this can show if someone has hemophilia type A, hemophilia type B, and how severe that effect on clotting is. The treatments for hemophilia A are to inject a clotting factor to either stop a bleed or to prevent bleeding incidents, or to inject the factor VIII that they're missing to help them maintain their clotting factors. The prevention component of treatment can help people with hemophilia A have a normal life expectancy, but one of the things that they really have to be careful of is planning any vigorous exercises around their treatments, because the treatments cause the clotting factors to vary so wildly. There are new advances in gene therapy that are starting to be implemented and tested more thoroughly for treating hemophilia A. These gene therapies for hemophilia A involve one treatment, hopefully, that will help the body produce its own clotting factor after the treatment. And as we can see in the diagram here, it works by using a vector to deliver the genetic material, which can then be transcribed and translated in the patient's own cells to get their body to start producing its own factor VIII. This isn't a fully proven treatment yet, but it does provide hope that patients with hemophilia A will be able to lead more normal lives without the constant treatments in the future.